Mental Health Trust on the Brink of Good Rating. A story of progress and persistent challenges. The Norfolk and Suffolk NHS Foundation Trust, NSFT, is inching closer to a good rating from the Care Quality Commission, CQC, but it's not quite there yet. Despite significant strides, the trust remains 4 percentage points shy of this milestone, currently sitting at 59% good, a rating that only kicks in at 63%. But here's where it gets controversial. While the CQC acknowledges improvements, lingering issues around workplace culture, staff trust, and accountability continue to cast a shadow. Could this be a case of systemic challenges that even the most dedicated leadership struggles to overcome? For years, the NSFT has faced criticism from patient groups and health inspectors, culminating in its placement under special measures. The latest CQC report rates the trust as requires improvement, a step up but still not the good rating everyone is aiming for. NSFT Chair Zoe Billingham remains optimistic, stating, "This is a strong report for the trust which contains some real positives. We are on the cusp of being rated good, yet the journey to that threshold has been anything but straightforward." The CQC's feedback: progress, but not without caveats. Stuart Dunn, CQC Deputy Director of Operations in the East of England, highlighted areas where the trust has made strides, such as board stability, management, and engagement with service users. However, he emphasized that more work is needed to ensure these improvements are consistent across the organization. Staff told us they felt services were starting to improve, Dunn noted. But many also said senior leaders weren't always visible or approachable. And this is the part most people miss. Despite leadership's awareness of workplace issues like discrimination and a lack of confidence in complaint resolution, these problems persist. Workplace culture, the elephant in the room. One of the most striking findings was the ongoing struggle with workplace culture. Staff reported feeling unable to speak up about concerns, and issues of racism and discrimination remain unresolved. While the NSFT claims to have implemented changes, the CQC's report suggests these efforts haven't fully translated into tangible improvements for employees. This raises a thought-provoking question. Can an organization truly excel in patient care when its own staff feel unsupported? A history of scrutiny. Chief Executive Caroline Donovan pointed out that the NSFT has been inspected 8 times in the past decade, making it the most inspected mental health trust in the country. She acknowledged the disappointment of not achieving a good rating but highlighted the CQC's recognition of progress, particularly in learning from patient deaths and working with families. "It's the first time the trust has sustained improvement," she added, "and our crisis services were literally on the cusp of good." Looking ahead, a commitment to change. Zoe Billingham reiterated the trust's dedication to improvement, stating, "We are not complacent, and we continue to work closely with our service users, families, carers, and partners to ensure our communities receive the safer, kinder, and better mental health services they deserve." But as the NSFT moves forward, the question remains, will these efforts be enough to address deep-rooted issues and finally secure that elusive good rating? What do you think? Is the NSFT's progress a testament to its resilience? Or does the persistence of workplace issues suggest deeper systemic problems? Do you believe the trust can achieve a good rating in the near future? Or are there fundamental changes still needed? Share your thoughts in the comments. We'd love to hear your perspective.